excel students from different states. So here, three entries were received and they were selected for the Best Student Award in the Outer State category. So those are, first one is Mr. Akhilesh Tiwari from Uttar Pradesh. He is B.Pharm second year student at Sri Sai College of Pharmacy, Upardha, Handia, Prayagraj, UP. So congratulations, Mr. Tiwari, for this Best Student Award for your outstanding academic performance. If you are with us, you can share your views, or your nominator is there, he can share the views.
Thank you, sir. Thank you, Dr. Dahiya, sir, for this gratitude. This is an honor to me to be a part of this meeting. Good morning to all of you. I am Akhilesh Tiwari. I am B.Pharm third sem student. I am student of Sri Sai College of Pharmacy, Handia, Prayagraj. I am so glad and I'm so glad and thankful to all of you for giving me this honor by in the form of this award. I would like to make special thanks to my parents and my principal sir, Dr. Sunil Singh sir, who prepared me and made me eligible for this award. I wanted to make some special thanks to my sir, to my teachers, and to my all seniors who have supported me in all my queries. And once again, I would like to make thanks to all respected members. And I am very glad to be a part of this wonderful meeting. And I wanted to make a thanks in my heart, from my heart, to all APP members that you consider me as this eligible award. That's you.
Thank,
I
thank you.
I am we have no
Thank
I have
you.
no word for this invaluable award. So therefore, sir, thank you so much, sir. Thank you all of you
Thank,
APP members
thank you, Mr. Tiwari.
once
It's
again.
all your contribution. Just we acknowledge it and you keep it up. Okay.
Thank you, sir. Thank you, sir.
Uh,
Thank you so much.
so uh, our next category, next award in the same category from different state goes to Tamil Nadu, Miss K. Charulatha, who is BTech third year student at Department of Pharmaceutical Technology, University College of Engineering at Anna University, BIT campus, Trichy, Tamil Nadu. So we congratulate Ms. Charulatha and we recognize her outstanding academic performance. If she is there, she can share the views. Otherwise, we can move next.
We are not able to see the slides.
You're not able to see my.
No, any of the slides.
So should I share again?
I think yes.
So there are options of sharing entire screen, window, or tab. So what I should select? Can anybody can help me?
Window.
Okay.
Keep
Right.
open the PPT and select window.
Okay. Thank you. So now the slides are changing.
Just please move one slide so that we can identify whether it can change
Now
or.
it came.
Yes, I can see the slide, but yes. Can you please change one slide more?
Changed.
No.
Now you are able to see my slide.
Yes, we can.
So what I'm not going on slide presentation, just I will change from here. I think so. So Ms. Charulata, you are with us to share your view.
Yes, sir. First of all, good morning to all and all. I'm grateful to be part in this meeting. Have gathered many knowledge in this conference, and this is my first conference to attend. Attend. Then,
Hello.
yes, sir. Thank you, sir.
Okay. So congratulations, Ms. Charulata. So we'll move to our next award.
Thank you, sir.
So next award goes to Mr. Swaraj Verma, who is B.Pharm second year student of US Ostwal Institute of Pharmacy, Mangalwad, Chittorgarh, Rajasthan. So we congratulate Mr. Verma for his vital academic output. So Mr. Verma, you are with us to share your views. Mr. Swaraj Verma. Okay, we can move next. Our next category is local category, which is belongs to the hosting institute at faculty level. So two awards are issued at local level. First award is Best Teacher Award, which goes to Miss Mortha Lakshmi Prasanna, who is Associate Professor at Department of Pharmaceutics, VJ College of Pharmacy, Rajamundry, East Godavari, Andhra Pradesh. Congratulations, Ms. Prasanna, for your outstanding teaching potential. So, if principal of the institute can share the views about Ms. Prasanna, or she is available with us to share her views. Anybody from hosting institute? Okay, we will move to the next award. The second award in local category is Best Performer Award, which goes to Mr. K. Venkata Fani Kumar Reddy, who is the B.Pharm student of VJH College of Pharmacy, Rajamundry. And this award is given in recognition of his overall outstanding academic performance. So, congratulations, Mr. Reddy, for this achievement. If you are with us, you can share your views. Otherwise, we can move forward. So, also for this particular conference, appreciation awards from the association are extended to Dr. Nalamili V.V. Jagan Mohan Reddy, who is the secretary and the correspondent, VJ College of Pharmacy, Rajamundry, and of course, Dr. D. Narendra, who is the principal of VJ College of Pharmacy, Rajamundry. So, thank you, sir, for giving APP a chance to host the conference at your beautiful campus and giving chance to honor your student and staff. Also, appreciation certificates are extended to the speakers, Professor Susan Julia Chand, for the wonderful and interactive lecture on herbal medicines, and also the upcoming physical lecture presentee Professor K. Karthikeyan from Wells University Vistas, Pallavaram, Chennai, Tamil Nadu, and Dr. S. Gananadhamu from Naipur, Hyderabad, Telangana, who will deliver on pharmacy practice as well as the pharmaceutical analysis area. And also, I extend on behalf of APP a special thanks to all the chairpersons and the local organizing committee. I extend my thanks, oral thanks to all of you who are who have involved in this online version of the conference to make it successful. Now I switch over to the organizer to conduct the event offline. Thank you very much.
Thank you. Thank you.
Thank you, sir.
I invite R. Yuvasri from third year B Pharmacy to give an introduction about our speaker K. Karthikeyan sir.
A very pleasant morning to one and all. This is R. Yuvasri from third year B Pharmacy. I was very honored to speak about Dr. K. Karthikeyan sir. Dr. K. Karthikeyan sir, M.Pharm, MBA, PGDCR, PhD. His educational qualifications: completed Doctor of Philosophy, graduated Master of Pharmacy, completed Diploma in Pharmacy and Bachelor of Pharmacy. Completed Master of Business Administration, has Hospital Management. Completed Post-Graduation Diploma in Health Sciences, has Clinical Research from various universities in Tamil Nadu. Work experience: currently working as Professor and Health Department of Pharmacy Practice in Vistas, Chennai, Tamil Nadu. He even worked in various universities as a Professor and Head Department of Pharmacy in Tamil Nadu. Awards: he have received Young Pharma Personality Award, Young Outstanding Academician Award, Dynamic Pharma Teacher Award, NFPS Best Teacher in Clinical Pharmacy Practice in Tamil Nadu State. Achievements: he has received International Travel Grant from Council of Scientific and Industrial Research, Government of India for presenting research paper at Global Conference of Pharmacy and Pharmacovigilance held at Australia. He received International Travel Grant from DST SERB ITS, Government of India, New Delhi for presenting research paper at Asian Confederation on Clinical Pharmacy Conference held at Vietnam. Professor E. Venugopal Gold Medal for Best Outgoing Student in M-Pharmacy Practice given by JSS University, Mysore. Conference: he was taken part in more than 120 conferences and international conferences, workshops, seminars, and presented the research papers and invited speaker at various events. Publications: he published more than 25 research publications to his credit, and we are very glad to have you here, sir. Thank you.
Pharmacy clinic, I sent a mail. Good morning to one and all. So morning session, I need more energetic. If people are fed up with only one session, huh? Say good morning. That's the spirit. Thank you. Okay. So so I'm staying alone in the stage, so I removed my face mask. Okay. So I request all of you to wear the face mask. It's not for chin or any other purpose to cover it. Okay. Wear it properly. So as a clinical pharmacist, so I hope all the set of pharmacists will be in here, the budding pharmacists. Okay. So try to create awareness. Okay. So we have been in pandemic situations, still we are not out of that. Okay. Thank you. So today's topic is pharmacy clinic. You all aware of this pharmacy practice regulations 2015 established by Pharmacy Council of India. Okay. So in that we have the provision to start this pharmacy clinic. Okay. So don't misunderstand that it's been pharmacy clinic, we can go for diagnosis purpose or any other things. Okay, so pharmacy clinic is generally a different one who when compared to the physician who runs the clinic. Okay, so pharmacy clinic is nothing but we have to do the clinical pharmacy activities at least. It's not clinical. Once we enter the hospital setup, it's been termed as a clinical pharmacy. But outside that, it's generally termed as a pharmacy, which can be again subdivided into hospital, community pharmacy, okay, retail pharmacy, or whatever may be the term we can use. Okay, usually the community pharmacist will have the vital role and also the leading bridge. Okay, so he is acting as a bridge, he or she. Okay, I'm not. Okay, so they are the one who act as a bridge between the physician and the patients. Okay, so the patients normally going to the physician, and due to the busy schedule of the physician, okay, and also the more waiting time for each and every patient, the physician not able to concentrate in that particular point of time. The pharmacist, the patient will come to the pharmacy and they may get the guidance from, so when to take these medicines and what time we need to take and what are the things to be avoided while taking these medications. Okay, so the pharmacist will be a friendly one. Okay, so he is the one who clarifies the doubt of the patient who has been oftenly visiting to his pharmacy. Okay, so this is the main thing, the pharmacy clinic. Okay, so this is nothing but the diagnosis, all the purpose. Okay, so we need to give them the proper treatment. Okay, so whether the treatment given to them is fulfilling their expectations and helping them to come out from their illness. Okay, this is the main concept of having this pharmacy clinic. Okay, so next slide please. So pharmacy is not just dispensing the drugs or any other things. Okay, so there is the duty is not being over. Okay, so whenever you dispense the drugs, okay, you just take the medicines and leave the pharmacy. Like that, we cannot tell at any point of time. Okay, so in most of the pharmacies being run by the non-qualified persons. Okay, so they may be act differently, but as a qualified persons, we need to make the patient very satisfied. And we need to provide them enough care. Okay, so whenever they have been visiting your pharmacy, it's not only a business, it's an art. Okay, so dispensing rules are applicable. Okay, so whenever the dispensing, whatever we have been dispensing, so we make them very satisfied before leaving the pharmacy, and the patient should have. And also we can put some questions also after giving our counseling to the patients. Okay, so when you will take these medicines, okay, at what point of time, and what are the things to be avoided, what are the foods to be avoided. Okay, if we ask them questions in a friendly manner, so the patient may respond in a proper thing, and we also make confirm that the patient has understand the concept of taking these medications. Okay, so if the patient going with a doubt to the home, so what will happen? It will lead to the non-compliance. They won't take the medications. Otherwise, they may take it in a wrong way. Okay, so these things will make them further more complicated. Okay, so already the patient coming with one complication, so it will lead to the another complications. So this is the thing. Pharmacy is not just dispensing drugs. Okay, next slide please. And looking like, see the pharmacy, so most of the pharmacies not been having enough space for running their pharmacy store itself. Okay, so this is the most worrying thing. Okay, the drugs regulatory authorities also been very sincere, and also they are not able to find, because the minimum space only available to run the shops. Actually, the pharmacy should have enough space for the waiting, for the patient waiting, and also we have to give time for them to attend the patient, whatever the queries they have been having. So we need to concentrate in a individual manner. Inter-individual things is needed. Okay, for each and every patient we need to spend much time, and we need to clarify their doubts before leaving the pharmacy, and we need to have some confidentiality room. Okay, so some space will be needed to make the patient sit so that the patient may come out with their doubts and we can clarify them in a confidential manner so that the patient may come out with more things they cannot express it in front of the other people. Okay, so we should have this pharmacy clinic. So it's look like corporate office, but we have to establish in such a manner so that we can have the health screening services at one corner also, so that we can monitor the blood pressure, blood glucose level, and the lung function test, everything we can do using the spirometer. Okay, whatever the things we can provide to them, and also the proper drinking water facility should be there, and toilet facilities we have to make. Okay, so if these things we can provide to the patients, they may happily, they may come and spend time, and they may even they may go late also. They won't be in hurry. If we are not providing all these things, so the patient may have to leave to the home or whatever may be there, wherever the place is convenient to them. Okay, so this is the main. Next. So pharmacy clinic, the existing concepts mean first one is medication review, medication errors, drug interactions, adverse drug reactions, and patient counseling. So these are the things we need to very concentrate, already existing things. So we need to concentrate much more than these existing concepts. So next. So active dispensing an art, not just act. Okay. So we need to dispense the drug like it's an art. Okay. So we should take it very challengeable, and we have to dispense the drugs accordingly, and we should not act. Okay. So it's an art. We should not act. Okay. So whenever the things, the person whoever needs the things, we can explain the how to administer or what are the doubts being asked by the patient. We have to act on that. Okay, so we need to respond, and we should take it as an art of dispensing the drugs. Okay, next one. So need of pharmacy clinic, a worldwide desire is that first one, these cases regarding the three conditions, the otitis media, the inflammation of the middle ear, and pharyngitis, okay, the sore throat, and urinary tract infection. So these are the three common things. So how the retail clinics provide comparable quality. Okay, so these are retail clinic, physician offices, urgent care centers, emergency departments. So in these four, so retail clinics play a much better role. Okay, so at lower cost also it's being minimized. So we have to consider the pharmacy is not only running like a business. I already told this. So we need to be concentrate on the pharmacoeconomic analysis also. Okay, so which the same drug which is available in lower price, we need to dispense that drug because it will improve the it will have the same therapeutic efficacy with the branded drugs also. So we need to concentrate, and if the patient is poor, so we need to give the drugs at lower cost. Okay, so which is ready-madely available, and this is the generic medicines. Okay, so branded is much more price is very high, so we need to concentrate on the generic medicines. So we can explain the patients, we can take these medicines. Okay, even though the prescriber writes the brand medications, so the patient is not affordable to spend that such a amount to buy the medicines. So again, if we have been insisting, no, the prescriber is written this branded drugs, so you need to take these drugs. So we are not in position to tell like that. Okay, so we should not do like that, and we should not entertain the things, and we need to promote the drugs whichever is reasonable. The price is very lower. Okay, so we need to give them we need to tell them, and we need to dispense the lower cost drugs the patient may afford, and the patient may happily they can take the medications. Okay, so if you are providing at lower cost, so that is the lower cost also plays a vital thing, and without discouraging the preventive care. Okay, so these are the three conditions we can improvise by providing the pharmacy clinic. Okay, so the patient, say for example, they are spending some 200 rupees for 10 tablets. Okay, the same drug which is available 20 or 30 rupees, okay, in generic formulations. Okay, so we can ask that patient to take the drugs, so the patient may happily take the drug and continue the therapy. Okay, if the price is very high, the same thing we have been with the branded drugs we have been giving to the patient. So they one time they may get that medicines, and the other next follow up they can't afford to buy the medication. So automatically they medication non-compliance will be there. Okay, so automatically they cannot come out from their illness, and they cannot come and report the same to the physician also. Okay, sometimes they may sit at home and the illness will be furthermore complicated. So this is the things we need to avoid if we provide some this pharmacy clinic data. Okay, so if we provide next. So medication review. Okay, so an initial step in pharmacy clinic. So what is the purpose of this medication review? So we need to know the condition of the patient. So what is the problem actually taking place in them, and next one the illness. Okay, then the drug treatment. So we need to identify the patient. So what is their illness and what is the therapy given to them. So based on that, say for example, if the patient coming with the same name, okay, so it's quite difficult to identify who is, say for example, some X. So the name again the patient will come with the same X. Okay, so we need to differentiate them. Okay, so even though the counter is very busy, the pharmacy has been very busy, so the patient's been coming in a huge crowd. Okay, so this may happen mostly in this corporate hospitals as well as in the government hospitals. Where when compared to the corporate hospitals, the patient may come in a large number in the government hospitals. Okay, so the patients may come in a large numbers. So in that time, these confusions may taking place. So even though the crowd is more, it's the pharmacist's responsibility to identify the correct patient and whether the dispensed drug is being given correctly to them or not. Okay, so we are not supposed to do the errors. Okay, so even though it is unpreventable, the medication errors is unpreventable due to some reasons. Okay, so we will see that. And it involves evaluating the therapeutic efficacy of each drug and the progress of the conditions being treated. Okay, so this is the main thing, medication review, how we need, for what we have to do this medication review. So we need to identify the correct patient, okay, and the right medications and for their illness. So this is the medication review mainly done. Next one. And therapeutic outcome is important than cost effectiveness. Okay. So this is as I already told this, generic drugs is also having the same therapeutic efficacy of the branded drugs. So we can consider them with the generic drugs. Okay, so we cannot. So some people will think in a different manner. Okay, if we provide the generic name, generic drug to the patient, so they may take that as a duplicate or whatever the thing. So they may take it differently. So we need to convince them. So the same drug, if you take, the price will be very lower, and they can the poor patients can easily afford to get the medicines. Okay, selection of best choice of drugs. So first one. So say for example, if the patient is coming with a bacterial infection. Okay, if you are giving the antiviral drug to the patient, is it effective? No. Why? Viral agents is very effective in the viral patients only. Okay, so we need to treat them with the antiviral drugs. But for bacterial infection, we need to give with the antibiotics, antibacterials. Okay, so this is the concept we need to take, and selection, and we need to identify the type of bacteria, whether it's a gram positive, gram negative. Okay, so based on that, we need to whether the given antibiotic is been the choice is very correct or not. Okay, so this is the selection of best choice of drug, and comparison of generic versus research molecule drugs. Okay, so first one is comparison generic and research molecule. Okay, so generic is already existing molecule in the market, and research molecules if any other things coming to the market, advanced thing, okay, so research molecule, so we need to give it to the patients, and we need to find out the therapeutic efficacy, whether it's been effective or not. Okay, so these are the things, and if the research molecule is better than the generic molecules, then the study has to be continued, and the research molecule has to be marketed. Okay, so then after the various trial processes. Okay, and reduce the average days of illness. Okay, so mainly what purpose we have been giving the patient. Okay, reducing the days. Okay, reducing the average days of illness. So the whatever the treatment given to them, it should adhere to their illnesses, and the patient has to be come out from their illness in short period of time. Okay, so we need to this therapeutic outcome is important. Okay, so we need to reduce the average days of illness. Okay, and reduce cost of treatment per year. Okay, so automatically now in all the family, the drugs for the medicines also, the budget is very high. Okay, even every month they are spending for provisions along with the list of medications. Okay, each and every family will have their one member will be there in the family. Okay, to spend for the treatment cost. Okay, so that we need to reduce. So these are the main advantage of having this therapeutic outcome. Okay, so these are the 4 factors. How would it be possible in pharmacy clinic? Next. So reduce the incidence of the medication error. Okay, so first one, so improve clinical outcome. Next. So the pharmacist's role in medication use process is prescribing, transcribing, dispensing, administration, and monitoring. So the medication error you all know, so is any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of the healthcare professional, patient, or consumer. It's a preventable event, but we need to identify it, okay, in the beginning itself. If it is not been prevented, so automatically the complication will be high. Okay, so in what way we can see the examples of the next. So these are the types of medication errors. So prescribing error, so errors in the act of writing the prescription or prescribing false, encompassing erroneous medical decisions resulting in harm to patients. So usually the prescribing error done by whom? Prescribing error, we have a provision to write a prescription. Prescriber, okay, is a doctor. Okay, so he is the one who makes this error usually. So these things we have to, as a pharmacist, when the prescription comes to the pharmacy, it's our responsibility to minimize the errors and to modify the corrections, and we have to send back the prescription to the prescriber. Okay, as it is we cannot change and we don't have any provision in changing, but we can give a suggestion to the prescriber. Sir, these things you made, you mistakenly written. Okay, so the dose is wrong. Okay, the dose is very heavy. Okay, so some sort of things we need to, and we need to inquire the, as I already told that, the type of a patient, the type of illness. Okay, so everything we have to keep it in mind whenever the prescription comes to the pharmacy. So we need to identify the illness of the patient. Okay, so what is the age of the patient? Okay, so everything we need to calculate, and we need to whether the dose is insufficient or not. So many calculations are there. If it is a pediatric prescription, so we have, what are the formulas available for calculating the pediatric doses? Young's formula, Dilling's formula, Cowling's formula, Clark's formula, based on body surface area. Okay, so many formulas are there. So it's our responsibility to calculate each and everything before receiving, after receiving the prescription. Okay, whether the drugs given in correct dose or correct time, correct frequency. Okay, all the things we need to notify, and if any error is there in the prescription, we need to send back the prescription to the prescriber for necessary corrections. Okay, so there we can avoid. Okay, as it is we cannot dispense it. Okay, if you dispense, there is no meaning in studying this course. Okay, and administration error. Usually administration error, who will do the administration? Nurse. Okay, so nurse also very busy profession. Okay, so they also have most importantly, they are also humans. Okay, so we cannot neglect whether whether it's a doctor or a nurse or a pharmacist, whatever the error done is done. Okay, so we have to rectify it. Okay, so it's the clinical pharmacist now entitled to enter the wards nowadays. Okay, so it's the clinical pharmacist responsibility to go and monitor the things, whatever the whatever the drugs written in the chart is being administered correctly or not. Okay, so that is why administration error usually done by the nurses. Okay, in what way it will happen? It may misinterpretedly, they may go and give the injection to the other patients. Okay, so due to the hurriness or whatever the things, okay, they want to finish the job very quickly and they want to leave us. They may be in some urgent, okay, the doctor may assign some other work to them. Okay, so because of that, otherwise some emergency cases may arrive to the ward. Okay, so many reasons may there, but it should not be entertained. Okay, so it's our responsibility to monitor whether the drug chart, as per the chart, the drugs administered or not. Okay, and transcription error, usually in the counter, so much of crowd will be there. So instead of that, one patient drug will be administered to the other patients. Okay, so because of that transcription error, so this may take place. Okay, and mainly it's done by the human operators. And dispensing error usually done by whom? Dispensing is by pharmacist. Okay, so dispensing error usually takes place whenever most of the examples I will giving in the next slides. Okay, usually the main problem is that LASA drugs, look-alike, sound-alike drugs. Okay, so based on that, the pharmacist may do the mistakes usually. Okay, and also the strip packing may be same. Okay, say for example, the diabetic drugs mostly from if the dose is 50 mg or 100 mg or 500 mg, they uniformly they may prepare. Only the strip, only color, some sort of color coding will be different. But the color of the manufacturing of the tablet, okay, the coating of the tablet may remain same. So due to that, the pharmacist take the medications and it may be wrongly dispensed. Okay, so we have to be very careful. Okay, the patient has to take only 50 mg. Instead of that, we are giving 100 mg means what will happen? So if say for example, the patient is hyperglycemic. So hyperglycemic patient, 50 is being diagnosed, 50 mg is sufficient for them. So if you give 100 mg, what will happen? What will happen? Hypoglycemic means suddenly the patient may walking, they may faint down. Okay, so it may lead to serious complications. So that is why we need to be very careful. And monitoring error, so failure to perform a thorough monitoring of the patient. So usually done by this, all the medical faculties. So we cannot restrict this to pharmacist level or nurse level or doctor's level. Okay, so monitoring error, it may all the medical faculties will be responsible. And drug duplications. Okay, error of prescribing multiple medications for the same indication purpose. Okay, so how many PharmD students are here? Which hospital you have been doing? PharmD is there? Yes? No. PharmD Illi. Okay. So if anything, I will give you the example. So if any doctors been writing, okay, so say for example, the patient complaining of some pain. Okay, so pain means they usually used to write one analgesic. Okay, so in that they may write one H2 receptor antagonist, ranitidine as well as PPAs, proton pump inhibitors. So this H2 receptor antagonist and PPAs will have the same action. Okay, so we need to go. So it's a usual habit of writing these drugs along with whenever the patient is been taking analgesics, these two drugs will be added. Okay, so there is not necessity at all. Okay, if the patient again, if the prescription contains antibiotic, it may increase the gastric acid secretion. Okay, to prevent that, the PPAs may be added. So along with PPAs, the H2 receptor antagonist also will be added. Ranitidine 150 or 300 mg, they may write. Okay, so these things we need to take to the notice of the physician, and we need to restrict them with either one category of drugs. Okay, so that is the drug duplications. Okay, next. So examples of prescribing errors. So see that this is a look-alike, sound-alike drugs where the mistakes will be done. Okay, so usually Livogen consists of ferrous and folic acid, and is rare. See, only one spelling, Livogen, Li, prescribing error. So Livogen, Le, sir, levofloxacin. Sir, complete setup is different. Okay, first one is the iron supplements, ferrous fumarate, and the second one is antibiotic. Okay, so in this way the prescribing errors may happen. So how you will correlate? You have to ask the patient's condition. So what purpose they have been prescribed? So what you have been suffering from? Okay, the patient is suffering from anemia. You can write, you can correlate with Livogen. Okay, if the patient is suffering from any other infection, we have to choose Livogen. Okay, these things we need to, if you thorough with a drug knowledge, then only we can identify. Okay, pharmaceutical companies are very the hub, pharma hub is our, India is one of the country. Okay, so we have more number of brands. Okay, so brands usually they may term with the generic only. Okay, so we need to be very careful, look alike, sound alike drugs. Okay, so plenty of list is there. We cannot have more than 1,000, 10,000 list is there, drugs, brands. Okay, so it's quite hard, it's quite difficult, but whatever the things we need to correlate with the things which has been written in the prescription, and we need to correlate with the conditions of the patient, whether what purpose is being administered, then only we can rectify this. Okay, and example 2 is PAN-D, pantoprazole 40 mg and domperidone 30 mg. It's a combination of the drugs, and prescribed BD per oral 10 days. Okay, so oral 10 days they have given, while the maximum dose per day of domperidone is 30 mg. Okay, is given BD, Bisindide, 2 times a day. So what? How much totally they are taking? 60 mg. Okay, again we need to calculate. Is only one dose is enough. Okay, we need to correct that. So these are the various examples of. And example 3 is illegible handwriting. Okay, and Lipitor 10 mg per oral QD. What is the meaning of QD? Quaternary, 4 times a day. Either it's a so illegible handwriting, if they made OD also, it may termed as QD and whatever. So we need to rectify. So it's all pharmacist's responsibility. Once the drug, once the prescription comes to the pharmacy, we need to rectify all these things, and we need to give a proper good treatment. Okay, so good medicines, correct medicines we need to give. Okay, next. So these are the examples of dispensing errors. Okay, and so QOD, QD. So these are the things. Okay. Usually it will happen in the Latin terms only. Mainly the misinterpretations will take place using the Latin terms. So mostly nowadays the doctors is not using this thing. Only you can see the government hospitals, if you go and see any medication charts, these Latin terms will be more common. Okay. So we need to be specific in the posology, all you are studying in pharmaceutics. Okay. Is it? Posology, what is mean by posology? So it's all have the Latin terms, the direction, how to take, when to take. Okay, all these things will be in the Latin terms. Okay, so these are the things, and for example, see that look-alike drugs, tablet Avil 25 mg and Lasik 40 mg is usual. Now also it's been the same. Okay, so this see the strip packing. So what will happen? Dispensing errors. So instead of what is the use of Avil 25 mg? Antihistamines. So what purpose is been given? Allergic, or if any sneezing is there, you can give cold along with the cold medications you can take, and also for allergic conditions. And what is the use of Lasik? Diuretics. Sir is only answering. I don't getting any answers from the student side. Okay, Lasik is a diuretics. Okay, increase the urine output. Okay, usually given in the edema conditions, it will be given. Okay, so urine output is less, we can give the less. So it's usually two different uses. Okay, so this happen, and hydroxyzine, hydralazine, bupropion and bucipirone. Okay, so these are the look-alike, sound-alike drugs examples. Okay, next. And drug interactions. So medication errors over. So how we are going to minimize the medication errors we studied, and now drug interactions. So drug interaction. So it's usually a substance which alter the other substance activity. Okay. So if you give the two drugs together, which will alter the metabolism or the action of the other drug, usually it takes place. So many of examples are there for drug interactions. So whenever you administer two drugs together, we have to check whether any drug-drug interactions is there, okay, any herbal drugs interaction is there, any food interaction is there. So everything we need to monitor. Okay, it's also one of the pharmacist's responsibility. Okay. Next. So give the best examples for drug interactions. Anyone knows? So if you give anti-diabetic drugs with antifungals, okay? Say for example, if pioglitazone, if you administered along with fluconazole, what will happen? Again, same class of drugs is most commonly prescribed nowadays. If any anti-diabetic medications is there, the hyperlipidemic, anti-hyperlipidemic medications also will be present. Okay, rosuvastatin, simvastatin. Okay, so along with pioglitazone, if you administer the drug, hyperlipidemic drugs, it will increase the concentrations of the diabetic drug, pioglitazone. So it's a very 5 mg, okay, pioglitazone. If you increase the concentration of pioglitazone, what will happen? It will go to 10 mg or 15 mg, whatever. So what will happen again? If these two drugs given together, it will increase the concentration of pioglitazone. What will happen then? Hypoglycemia. So monitoring is required. So whenever, so what will be your inference? What will be your inference to that? So we make the patient to take the medication pioglitazone first, give some interval, then we have to administer the hyperlipidemic drugs. So in this way we can do that. Okay, if we administer both the drugs together, it will increase the concentration. So many examples are there. So if you go, it's a very huge topic. If you go, so daily some studies been going on the been developing drug-drug interaction pharmacokinetics. Okay, if you put in a Google or whatever, maybe if you go on Stocklist drug interactions books, okay, you can get plenty of examples. Okay, so what are the drugs we should not take together? Okay, if we take together, so what are the things we need to monitor? So all the things you can find out. Okay, hope you have the book in your library. If not, try to educate them. Okay, it's a pharmacology book only. You can study with the clinical pharmacy. Now the curriculum also has been changed. Okay, so many diploma pharmacy students are there. Here, D-Pharm? No. Okay. So this is to avoid interactions, suggestions to avoid an alternative drug of choice, and cost as well as the therapeutic effective. So in this way we need to avoid the drug interactions. So you just go for next one. So this is an example. Digoxin, amiodarone. So both are being anti-arrhythmics, right? Okay, so amiodarone and digoxin. Digoxin, you know what category it comes under? Cardiovascular, arrhythmic drugs, and one more category is a potent drug, highly potent, 0.25 mg per day. 5 days only we used to give, 2 days we need to give rest. What will happen? Why we have been giving that 2 days rest? It will increase the atrial fibrillation. Okay, the fluid retention will be there in the body itself. Okay, and if you start the drug on Monday to Friday only, it will begin. 2 days rest they have to give, because it has to eliminate, the fluids has to be eliminated from the body. Okay, the pedal edema all will form. Okay, puffy, facial puffiness will be there. Pedal edema, facial edema. Okay, all the fluids will be retained in the body. Okay, it has to go out. Okay, so this is the main thing. So if you give amiodarone and digoxin, resulting in digoxin toxicity and potentiated effects of amiodarone, so all the things will happen. Okay, so already the patient is on cardiovascular complications. So if you give these drugs together, again bradycardia, sinus arrest, atrioventricular block, everything will happen. Okay, again we need to give another drug. Okay, so we have to be very careful while giving the drugs together. Okay, each and every drug will have the drug interactions, and most of the drug interactions which is been documented in the standard textbooks, been studied in Western population. Okay, so in our Indian population, most of the drugs, most of the patients not suffering from any major interactions and any other adverse drug reactions, because of only one thing, is a genetic polymorphism. Okay, so we have entirely a different set of CYP enzymes, cytochrome P450 enzymes, which is the most responsible for the metabolism of the drugs, whether it may be inducer or inhibitor or substrates. Okay, so whatever may be, the drug will act on these enzymes. Okay, it will be present mainly in the liver, so it metabolizes the drugs. Okay, so we have usually CYP3A4 and CYP2D6. So these are the two gene we have in our population. Okay, so most of the drugs will be metabolized by CYP2C8 and CYP2C9. Okay, so it's completely absent in our population. It's been proved by Dr. Adityan from Jipmer, Pondicherry. Okay, so they have a very good genetic measurements. Okay, so they may prove that it is completely absent. So most of the drugs, so say for example, if you take rosiglitazone is banned. Okay, troglitazone is banned, nimesulide is banned, but still it's been executed, still it's been running. Nice, if you heard about the famous brand Nice, for headache or fever, nowadays also it's been prescribed. Why? It's already proved that it has been elevating the liver enzymes in the majority of the population. Okay, so that is why these enzymes been very highly responsible for this, and we don't find any other complications. Okay, and you all know about the thalidomide. Okay, is what happened. It's been given for the morning sickness during the pregnancy period. Okay, it's happened whenever the administered, the fecal abnormalities taken place. Okay, now again it's been coming back to the market, that too in our country, but we don't find any fecal abnormalities in the pregnancy woman. So that is the condition where the genetic polymorphism plays a vital role. So we have not the enzymes not been present in our population, and that's why the most of the drugs been still existing in our country. Okay, and drug food interaction. So tetracycline milk, you all know. Okay, so what will happen if you take tetracycline with milk? Chelation will form, and this discoloration of teeth will take place. Okay, this is a famous thing. And drinking coffee in close succession to thyroid medications. Okay, so whenever the thyroid is present, we should avoid the coffee and tea and all other things. So these are the food interactions. Next. And finally comes to ADR. So adverse drug reaction. So now is defined as one which is noxious and unintended and which occurs in doses normally used in human for prophylaxis, diagnosis or therapy of disease or for the modification of physiological functions. Okay. So these are the mainly usually next slide. We can see the classification. So type A, type B, type C, type D and type E. So type A is augmented. So usually it is predictable. Okay. So whenever you are taking the medication, we have enough sort of evidence. So whenever if you are taking this drug, these things going to happen. So it's predicted. Okay. So we can treat that very efficiently and we can come out, we can make the patient to come out from that adverse drug reactions. So this is type A augmented. So examples, bleeding after anticoagulants, hypoglycemia from insulin. So whenever if you are withdrawing the anticoagulants, the bleeding can be stopped. And whenever if you are withdrawing the insulin, the hypoglycemic effects we can reverse it. Okay. So these are the things. So we know the basic concepts of how the drug is going to act. And the second one is type B is a bizarre. So dose independent, rare and unpredictable. Bizarre in the name is unpredictable and not explained by pharmacological drug effect. So that is called urticaria from aspirin and exanthem from antibiotics. So these are the two conditions which will happen, which is unpredictable. It may happen or it may not. Okay. So type C is chronic, dose and time dependent. It's a rare and long-term exposure. Okay. So whenever you are taking the drug for longer period of time, so that time these things may take in place. Chronic. Okay. Cushing syndrome from cortisone. And delayed type D. Okay. So in the name itself, delayed effects. Okay. So whenever you are taking the drugs for longer period of time, the ADR also will get delayed. Okay. Time dependent, very rare. Kidney disease from long-term analgesics or non-steroidal anti-inflammatory drugs. Okay. So it's usually, so when you are, if you are taking the analgesic drugs, you should be very cautious. So we have to educate the patients or otherwise your neighbors or your relatives, whoever been using the analgesics for longer period of time. So we need to tell them. Generally, it may not applicable only for the analgesics. It may also for so many drugs. Okay, if metformin for diabetes, okay, if any kidney failure or any patients, so we need to be very cautious in administering the metformin. Why? It will, the kidney failure patients, the creatinine level will be more whenever we administer the metformin. So we should be very careful. And this is the delayed effects. Okay, and type E is end of treatment. Time withdrawal effects of drugs, example opioids or, and this is a time dependent, rare relapse after stopping a therapy. Okay, whenever if you are taking opioids or anti-epileptics, okay, rebound or relapse phenomenon. Okay, so this is the things. So whenever if you are administering anticonvulsants, the patients will not have the convulsion activities. So whenever if you are withdrawing the drug, the action will take place again. So seizures will happen. So this is the example of the types of ADRs. Next. And ADR reporting and monitoring, you all heard about this now, Indian Pharmacopoeia Commission, IPC. Okay, it was established under Ministry of Health and Family Welfare, Government of India, a separate thing. Apart from that, pharmacopoeia, establishing the pharmacopoeia, you all know about pharmacopoeia? What is pharmacopoeia? Drugs. List of the details of the drugs which is available in our country. Okay, so they are the one who is responsible for the National Formulary of India. Okay, so they made this Pharmacovigilance Program of India, PVPI. Okay, so many pharmacy graduates been appointed in that particular commission, this particular program, especially the PharmD graduates been given so many responsibilities in that. So previously, the ADR, the common people, only the physician can report. Okay, so that's quite hard, and no doctors will come and report because they have been working under some management or they may be working under government, or they may be working under private. Okay, they cannot, they themselves cannot report it. This happened due to the drug. Okay, that may spoil the reputation of their hospital and whatever they have been working with. Okay, working with that organization. So this PVPA program now they made mandatory that a common man also can report the ADR to the authority. Okay, they produced one app. You can go to the Play Store, you can download PVPA app, and you can also, as a healthcare provider, you can educate this to the common people who have been facing these adverse events. Say for example, if I am a known case of allergy, if I take ciprofloxacin, the blisters will take place in the lips. Okay, so I am aware of that. So whenever I am going to the hospital, I just go and tell that I am allergic to this drug, ciprofloxacin. Don't prescribe ciprofloxacin to me. Okay, so how many of you know the known case of allergy? Okay, so allergy card will be available, so that also we can keep it in the pocket. Okay, so that if anything happens in the road or whatever things, so the card will help them. Okay, the patient is being known case of this, like that. Okay, so that way you can report if any adverse drug reactions taking place, we can report it to the concerned authorities, and it may be documented and it may be sent to the WHO. Okay, Uppsala Monitoring Center in Sweden. Okay, the data will be all the data will be received, especially for this, and also now this ADR reporting been mandatory to the pharmaceutical industries also, and they establish their own PVPA setup in their institution, and all the regulatory authorities also they have been monitoring this, and especially whenever the drug comes to the market, phase 4, what is phase 4 trial? Post-marketing surveillance. Okay, so post-marketing, the industries previously, after the drugs comes to the market, their role will be minimized once upon a time. But now the post-marketing surveillance is made mandatory by the PVPA program, and also it forces all the government hospitals, private hospitals to set up a special ADR monitoring center in their hospital. Okay, so now if you go to any major hospitals or so now they have been steadily, and previously the headquarters also is very less. Now they have been planning to establish all the headquarters in all the states. Okay, so it's been slow and steadily they have been doing that. So once it comes to the practice, so it's all our duty to report the ADRs to the, you can download it, you can refer the PVPA app. So what is the actual things being doing? Okay, so you can download it from Play Store. Okay, and shall be reported to clinic, follow-up and monitoring alternative drug suggestions. So just go for next slide, example. So these are the examples. Okay, spironolactone induced gynecomastia. So this is a thing usually normal male breast, and after the spironolactone, so what will happen? The enlargement of the mammary glands take place. Okay, so it looks very unusual, right? Okay, so it's good. It's not looks good. Okay, so that is a gynecomastia. And amlodipine induced gingival hyperplasia. So see the inflammation of the gums. Okay, so whenever if you are administering amlodipine, so it will take place gingival hyperplasia. Okay, next. And finally, patient counseling. Okay, so these are the various activities. Finally, patient counseling. Why I kept patient counseling finally? So you need to understand what are the things happening among the patient populations, as well as what are the service we can render to the patient communities. Okay, so this is the thing. Patient counseling is providing medication information orally or in written form to the patient or their representatives, and directions of use, advice on side effects, precautions, storage, diet, and lifestyle modifications. Okay, so these are the patient counseling things. What are the way we can give? And while giving the patient counseling, whenever the patient comes to you, you should not show any type of reaction. Once he or she showing the prescription to you, you should not raise any type of reactions, especially lifting your eyebrow, okay, Okay, you should be very confident. You have to welcome them with a very good manner, pleasant manner. Okay, you should not show any type of reactions in front of them. Okay, so patient counseling if you take, and also the distance, posturing, face to face. Whenever he comes, you should not sit like this. Sit. We should not do like that. Okay, so we have to welcome them, and if you have any doubt in front of them, you should not go. You take your mobile and search. Okay, so you can have. So you just wait for some time. If you have any doubt, you just go. You have a library at your place, or you have your any standard textbooks, or any other system is there. You can go and refer it and come back to that patient, and you attend the counseling session. Okay, this is the most important thing we need to follow. Okay, in front of them, we are not supposed to raise any doubts, and we should not show ourselves we have been in doubt. I am not know about this drug, so there is no meaning. Okay, so the patient, what will happen? What will they think? Okay, these people itself not knowing why. What is the use of going to this pharmacy? Okay, so that is the main thing. We need to avoid all these conditions, and especially the psychiatric prescriptions. Okay, so once it comes to you, you have to make sure the patient is being in a what do we say, in correct condition, or otherwise we ask them to stay outside and ask the attenders to come and attend the counseling. Okay, whenever, especially in the psychiatric conditions, we need to be very careful in dealing the patients. So they are already psychiatric patients, they don't know what they are doing. Okay, so in front of them, oh, you are a very disturbed patient, you come here, you sit here, like that we cannot do. Okay, we have to treat them in a good manner. So this is the patient counseling, and also what are the drugs they have been taking. Okay, in the previous session, Dr. Susan Madam was giving a very good interactive session regarding the herbal preparations. Okay, so this very important concept nowadays, the thrust area of ICMR, herbal drug interactions. Okay, so that's a very we need to very concentrate very hardly, because herbal preparations, if you take any one herb, it have more than 50 to 100 active principles in it. Okay, it have a leaves, barks, root, stem, okay, flowers, buds, fruits. Okay, if you take each and every plant, each and every part will have their significant actions. Okay, so we need to be very careful which part we are going to use, and what are the drugs been isolated from that. Okay, so that's why these herbal drug herbal and allopathic preparations been taken. Okay, Dr. Dahya sir also taken all the medications. It's available in Himalaya, all the herbal preparations available in Himalaya. But my question is that whether it's been standardized, any particular product being isolated from that is being isolated and it's been capsuled or it's been formulated. So that is the most worrying thing. Okay, so whatever the drugs, and Dr. Dakia, I have to appreciate him. Only he is going with one system of medicine. He is not taking allopathic medicines. He is taking only herbal preparations. That is safe. Okay. Once if you are taking herbal preparations along with that allopathic preparations, then our condition is very complicated. So why I am saying this? So the patient is already on allopathic therapy. Especially these herbal preparations play a vital role in diabetic people, mainly the diabetic. Okay, so ours is the China and India has been fighting. So who is going to be number one? Who is going to be? So once upon a time we got a number one position. Now China. Now we are lacking behind. Now little. Okay, so this is not going to be the thing. The diabetes capital of the world. Who is going to be in that position? China and India is fighting. Okay, so this is a way where more this herbal preparations been dominating in our country without any standardized techniques. Okay, so that is why it's our responsibility while doing the counseling. So what are the other preparations you have been taking along with the allopathic medications? Okay, so it usually happens mostly say for example fenugreek is most powerful herbal preparations in the diabetics. Fenugreek powder, daily morning if you take one spoon of fenugreek powder in a glass of water, if you drink, is very effective. And Momatica charegam, this bitter melon, That also very effective. All the bitter principles, whatever be available in this, now this moringa, what about that? So many preparations. This jamun seeds, very effective. Okay, so all the preparations that Dahiya has, whatever he showed, is very effective if you take it alone itself. Okay, if you are B.Pharm student, you can conduct a study who is taking only the thing and who are the people who have been taking allopathic. Just compare the data. Only allopathic and only allopathic. Only herbal and only allopathic. Then you can definitely, because this is my PhD topic, I proved that only herbal preparations, if you take, is very effective. Okay, at the end of the study. Okay, so this is the thing we need to, what are the herbal preparations, because these things will be hidden by the patients to the physicians while going for their regular checkups. Okay, so these herbal preparations may be influenced by their neighbors or their friends or whoever may be. Okay, they may influence, okay, this you take, okay, along with the allopathic medication, if they take, suddenly they are walking to the road or whatever, they are riding the bike or whatever, driving a car, suddenly they may faint. So most of the accidents also will take place. Okay, so we have to identify them and we need to advise them going with one single therapy at a point of time. Okay, so this is my thing. And the role of clinical pharmacist. Next slide, please. Identification of drug interaction, dose adjusting, identification of side effects, drug information source we can provide. Okay, so we can act as a, so what are the drugs where it is available and what price we can give the details, and drug selection, medication review, and provide information about cost and cost effectiveness, patient counseling, and provide information about medication efficacy. So these are the various roles performed by clinical pharmacist. It's not only clinical, you can take it as a role of pharmacist. Okay, next. Thank you.
So thank you, Professor Karthikeyan. So he has given a very elaborate thing about the role of a pharmacist in clinical site. Hope all of you has listened the lecture very keenly and you can note down some points and hope that you will practice it in future. With this small thing, I request Professor K. Ravishankar Garu, Principal of Aditya College of Pharmacy, Sorampalam, to chair the session.
Thank you, sir. Thank you. Good afternoon. At the outset, I'm very sorry. My throat is very bad. However, I will try my level best to give you a clarity speech. Thank you, Dr. Karthikeyan. He has given you very informative information about the pharmacy practice and the role of pharmacists, not only in India, in the entire globe. Most of the important salient features about the pharmacy practice has been elaborated by Dr. Karthikeyan, mainly about the drug interactions, side effects, adverse effects, and dosage range. And he has given you very good examples about the drug interactions between two drugs. At the same time, the dosage needs to be monitored. I need to thank you very much, sir, because I could able to recollect my old days, wherein I practiced pharmacy practice for about 9 years in abroad. That is in Bahrain, Oman, and Libya. I was sharing the same thing with my classmate, Dr. K. Srinivas. The very important slide which you have shown in the second slide, that is a modern pharmacy. That type of pharmacies we expect even in India very soon. In India, the size of the pharmacy should be about 100 square meters. This is absolutely wrong. In abroad, you see at least about 2,000 square feet. Minimum 1,500 to 2,000 square feet. And you'll find everything there. Name, everything is available, including health effects. The most important aspect which has covered is patient housing. That is still not completely existing in India, but however, some states like Kerala and West Bengal and some parts of Maharashtra, they are implementing this patient housing centers, which is considered to be very, very important right now. Almost all the important features of the pharmacy practice has been elaborated, and I hope any pharmacy graduate or would be graduate and pharmacy students will be highly grateful to have this wonderful position. And very important aspect he has mentioned, I don't know how many people have understood, that is the comparison between the generic and the research product. This is very, very important. In India, generic product has taken a very, very important role because of the cost effectiveness. But in abroad, life-saving drugs are very costly. But in India, for example, Thalidomide, 10 tablets cost about 5 rupees, if I'm not wrong. But whereas the same Dispensing manufactured by Birmingham or Park Babies, glucose, cost about 4.5 dinars for 30 tablets. Such a very costly. All life-saving drugs are very costly in abroad. As you mentioned about the comparison between the generic and the research product, if I'm not wrong, I still very remember once in GCC countries, the entire so-called is being taken over by Saudi Arabia. And once the local manufacturer they put the price of Thalidomide very low, and after using 5 mg twice, thrice, 4 times, properly the hypoglycemic effect was not observed, and suddenly the patient died because of the generic. Whereas in India, almost all the generics are being manufactured by the very leading companies like Cipla, Ranbaxy and Sun Pharma. Even though they are manufacturing the research products, even also they manufacture even generics just because to reduce the cost effectiveness. Once again, I thank Dr. Karthikeyan. He being a pharmacy practice HOD and professor, he could able to deliver his fantastic information to the heights of the students. Thank you very much, sir.
Thank you, sir. As a token of gratitude, there is a felicitation to Professor. If you have any doubts, please ask. Regarding this session? Yes, sir. So it's time to gratitude. So felicitation is there to Professor K. Karthikeyan. So for this session, I request Dr. D. Narendra sir, Dr. K. Srinivas sir, Dr. C. H. Suresh sir, and Dr. Gananathan sir onto the dais.
Good afternoon to all. The 5th Indo-Caribbean APP conference was a great platform for the young budding pharmacists. Always the Association of Pharmacy Professionals Association have been involved, and very happy I have been a part of it today. I delivered my talk, and I was very happy when I am seeing that Dahiya sir has been giving plenty of motivations. Okay, so by means of awards and certificates, both at the faculty levels and for the student fraternities. Okay, so the best pharmacist, best student award. So all the awards been great motivation. Where none of the associations been not doing this, and I'm very happy. I'm recently been enrolled myself as a life member in APP, and really I've been proud of it by entering into this APP family. And it's a great platform for you people to learn, and you also become a part of the APP in future, and you can engrave yourself to a good knowledge, you can gain good knowledge. And I thank all the organizers, the local organizing committee, Dr. Narendra sir and Dr. Jagan Mohan Reddy sir, and for giving this opportunity, and also the other APP executives and the leaders, okay, and the principals from the other institutions who have gathered here. And thank you for the opportunity. Thank you.
Thank you, sir, for your wonderful session. So now I request the delegates to go for lunch. So we'll be back by 1:30. So I request all the delegates to be in the seminar hall by 1:30 itself. Thank you.